Spine surgery with OSS Health. The purpose of this video is to provide you with a comprehensive look into why spine surgery was recommended, along with the tools necessary to prepare for a positive experience. Anatomy of the spine. The spine is divided into 4 separate regions. The first region is the cervical region, which includes 7 vertebrae. The second is the thoracic region, which includes 12 vertebrae. Third is the lumbar region, which includes 5 vertebrae, and lastly is the sacral region, which includes 5 fused vertebrae. Common spine disorders. Stenosis, which is narrowing of the spinal canal, osteophytes and ligaments, hypertrophy, and decrease the space available for the nerve root. This can put pressure on the nerves and can cause arm and/or leg pain. Disc herniation occurs when the soft center of a spinal disc pushes through a crack in the tougher exterior casing. Intravertebral discs have a softer center surrounded by a thick outer ring of tissue. This can put pressure on the nerves and cause pain. Instability of the spine, also known as spondylolisthesis. Instability of the intervertebral discs and/or the posterior facet joints leads to slippage of one vertebral body in relation to another. If severe enough, this can compress the nerves and cause back and/or leg pain. Scoliosis, which means curvature of the spine. This can be due to developmental or degenerative causes. When treatment is unsuccessful with a brace, surgical fusion of the spine is often recommended. Common cervical spine surgeries. Anterior discectomy and cervical fusion, also referred to as an ACDF. This is an anterior approach to remove the intervertebral disc and joins together 2 or more vertebrae with bone or metal implants. Cervical disc replacement. An artificial disc is inserted between 2 vertebrae after a discectomy has been performed. Lumbar spine surgery. A corpectomy is when all or part of a vertebral body is removed. A discectomy is when all or part of an intervertebral disc is removed. A lamectomy or laminotomy is when all or part of the lamina is removed. A spinal fusion is when 2 or more vertebrae are joined together using bone and metal implants. Scheduling your surgery. Once it is decided with you and your surgeon that you will be scheduling surgery, the team will be getting the process started. Depending on the procedure and your health history, this will be scheduled at OSS Hospital, York Hospital, UPMC Memorial Hospital, or UPMC Hanover Hospital. You will fill out an Oswestry medical assessment, which is also known as a patient-reported outcomes. These are completed prior to your surgery, as well as approximately 1 year after surgery. Patient-reported outcomes. What is a proform? They tell us how your back or neck is affecting you before surgery and then again after surgery. We would like to know this information so we can keep track of how well you do after surgery and if the surgery improved your quality of life. You will do these forms when your surgery is scheduled, 6 months after your surgery, and 11 months after your surgery. The proforms are your report card on how well you are doing. Please be sure you complete them, especially after your surgery, when often they might be mailed to you. We even send a prepaid envelope for an easy and convenient return. Preparing for your surgery. Spinal surgery is a major surgery. The pre-surgery evaluation is an important part of your care. This will help you decrease the risks of surgery, decrease risk of complications and allow us to manage any potential complications, and decrease your recovery time. Pre-surgery phone calls. In order to optimize your care, you will receive calls from several different members of our hospital care team. Pre-surgery scheduler and/or closer. This will be your initial caller after choosing to proceed with surgery. They will schedule your pre-admission appointment and testing. Registration will call approximately 1 week prior to your surgery. They will review your demographics and will discuss any copayment you are responsible for day of surgery. A case manager may call about 1 week prior to your surgery. The case manager will address any concerns you may have about discharge planning. You may receive a call from a pharmacist. They may call to discuss medication allergies or concerns you have about medications while at the hospital. And lastly, a pre-admission testing nurse. You will receive this call the day before surgery. If your surgery is on Monday, they will call you on Friday. The nurse will review your medical history and medications. The nurse will go over any other pre-op instructions as well as give you your arrival time. Surgical pre-admission appointment and testing. This includes history and physical examination, education about your surgery and post-operative instructions. In some cases, blood work, a chest x-ray, nasal swab, and an EKG may be required. Completion of paperwork that is needed prior to your surgery. You can expect a practitioner will review your past medical history and perform a medical exam. A pre-surgical educator will provide information and education. Based off your past medical history, additional appointment or testing may be required. The pre-surgical closer will coordinate any other appointments or studies that may be needed for you. You will be fitted for a cervical collar or back brace if needed. This is up to your surgeon preference. You can prepare for this appointment by taking your medications as normally prescribed. Bring either your medication bottles or a complete list of medications, including supplements and over-the-counter medications with dosages. Bring a list of your allergies. Bring a list of physicians that you regularly see. Bring a list of past surgeries that you have had. If you have a pacemaker, defibrillator, or cardiac stents, please bring your implant cards with you. Antibacterial scrub instructions. We use the scrub to lower the germs on your skin and help reduce any chance of infection. You will use the scrub in the shower daily for 5 days prior to your surgery. You can prepare to use the scrub by changing your bed sheets the day you start the wash. You want to wash with your own personal products such as body wash, soap, shampoo, and conditioner. You'll apply the scrub from the neck down. Avoid getting the scrub in your eyes, ears, and private areas. You leave the scrub on your skin for 5 to 10 minutes and then wash off. You will not wash with normal soap after using the scrub. Showering is the best method, but if only a tub bathing is available, clean your tub after each use. Next steps, use a clean towel each day when showering. Put on clean clothes after showering, and do not use lotions, creams, or powders after showering. Underarm deodorant can be used. Surgical site infection prevention. What OSS does to prevent infection. OSS screens each patient for MRSA and MSSA prior to surgery at OSS Hospital. Patients use a special preoperative scrub prior to surgery. Preoperative antibiotics are administered within 1 hour of surgery. All operating room staff wash their hands and arms up to the elbow with an antiseptic agent prior to surgery. All operating room staff wear special hair covers, masks, gowns, gloves during surgery. Healthcare workers clean their hands with soap or alcohol-based hand sanitizer before and after caring for each patient. The surgical dressing is left in place until it is changed with a sterile technique. As the patient, you too can help prevent surgical site infections. Please tell your doctor about other medical problems such as allergies, diabetes, and obesity. Quit smoking. In some cases, your surgeon may require you to quit prior to receiving a surgery date. Do not shave near your surgical area. If you are diabetic, please make every effort to control your blood sugar. Ask your healthcare provider to wash their hands if you do not see them do it, and use your antibacterial soap as instructed prior to your surgery. MRSA and MSSA is a germ that lives on the skin of about 25% of people. These people are carriers of the germ, which can cause an infection at your surgery site. If you were to test positive for this, we want you to try and remove it from your skin prior to surgery. All patients who are found to be MSSA or MRSA carrier will receive the following: a phone call notifying you of the positive result. A prescription will be faxed to your pharmacy for Muprosin or Bactrim to apply to both nostrils and under your fingernails for 5 days prior to the day of surgery. You will be instructed to refer to the form titled Preoperative Preparation for MRSA and MSSA colonized patients. This form must be completed and brought with you the morning of your surgery. Preparing for surgery. 2 weeks prior to your surgery, you will stop taking any herbal supplements and multivitamins. Discuss any blood thinning medications that you are taking with your medical team. 1 week prior to surgery, stop taking any arthritis medication and anti-inflammatory medications. Begin to drink at least 8 cups of non-alcoholic liquid per day. If your doctor has you on a fluid restriction, please follow their instructions. If you are on a blood thinner, OSS will contact your prescribing physician and notify you when to stop this medication. Medication patches. If you are currently using a prescription patch for any reason such as pain management, control of blood pressure, estrogen replacement, please bring a copy of the prescription with you the day of surgery. If you do not bring a copy of the prescription with you on the day of surgery, we are unable to verify the medication of the patch and will need to remove it and replace it with one of our own to ensure your safety. Preparing for surgery continued. Nutrition, you want to eat balanced meals to maintain weight. Continue to monitor your blood sugars if you are diabetic. Physical therapy, practice exercises regularly to increase muscle strength. You want to stop smoking or using any tobacco products, which includes smokeless tobacco, e-cigarettes, vapor cigarettes. This will increase your risks with anesthesia, could cause any post-operative respiratory complications, wound healing delays, and any amount of nicotine in your bloodstream hurts your ability to heal bones and other tissues of your body. 1 week prior to surgery, drink at least 8 cups of fluid per day. We encourage you to increase your fluids as this decreases thirst prior to surgery. It is harder to obtain IV access when fluids are decreased, and this also will help decrease nausea after your surgery. Special circumstances, avoid increasing your fluids if you have severe GERD or if your doctor has you on a fluid restriction. Preparing your home for surgery. Make modifications to your home prior to surgery that will decrease your risk for falls or injury. Move electrical and telephone cords away from walkways. Use chairs with armrests. Avoid low chairs or sofas, and remove any throw rugs or use skid-resistant backing. Stairways. Replace worn stair treads. Install stable handrails on both sides of the stairs. Stairs and hallways should be brightly lit. In your bathroom, you may wish to install grab bars in the bathtub. You may wish to install skid-resistant strips or a rubber mat both in and in front of the bathtub to avoid any falls. In your bedroom, it is suggested to have a lamp and phone within reach of the bed. Keep a clear path from the bedroom to the bathroom. Always sit while getting dressed. In your kitchen, store frequently used items at waist level and less frequently used items in higher cabinets. It may be helpful to prepare and freeze meals prior to admission to the hospital. Preparing for your hospital stay. What to bring with you. A photo ID, your insurance cards, a list of all of your current medications, a copy of Advance Directive and Living Will if applicable, loose-fitting clothing, tennis shoes or a good supportive shoe with rubber soles, assistive devices such as a cane, walker, or CPAP if applicable, lumbar corset or cervical collar, cell phone and charger, toiletries, eyeglasses, and/or contacts. Items you may leave at home are your personal medications, any large amounts of cash, credit cards, valuables, and jewelry. The day before your surgery, you will receive a call from the hospital pre-admission testing nursing staff. If you are having surgery on Monday, you will receive the call the Friday before. This call usually comes after 2 p.m. This phone call will include a review of your medical history and medication. The call lasts about 15 to 30 minutes. They will instruct you on the following: the time you need to finish the sports drink, where to report when you arrive, the medications that you should take the morning of surgery, and the medications that you should not take the morning of surgery. The day before surgery, you want to drink at least 8 cups of non-alcoholic fluid throughout the day. Additionally, drink 12 to 16 ounces of Gatorade or equivalent sports drink that evening. Do not shave or use any hair removal products near your surgical site. No smoking after midnight. This includes smokeless tobacco, e-cigarettes, or vapor cigarettes. No food or alcohol after midnight. This includes candy, chewing gum, or mints. The morning of surgery, you may take certain medications with a small sip of water as instructed by your doctor. Do not apply any lotions, scented products, hair products, powder, lipstick, chapstick, nail polish, etc. You may take a shower and brush your teeth. Drink 12 to 16 ounces of fluid as directed, preferably Gatorade or equivalent, not red in color. OSS Hospital. Arrival at the facility. Enter at the main entrance of the OSS Hospital and proceed to the reception desk immediately to the left upon entrance. Registration staff will get you checked in. You will be asked to verify your personal information. You will be asked to provide contact information for your support person. You will be asked to sign additional paperwork, and you will receive an ID bracelet. How to prepare for this is to bring a valid photo ID and insurance card, and please bring any estimated copays, coinsurance, and/or deductibles. Preoperative area. The staff will check your hospital bracelet. You will change into a hospital gown. The nurse will start an IV. You will meet with the anesthesiologist and surgeon. The anesthesiologist will discuss and administer a nerve block to help with pain control. Your surgeon will answer any remaining questions and sign your correct surgical site. What to expect in the operating room. You will be brought back into the operating room on a stretcher. Your ID will be checked again. You will be repositioned on the operating table. The anesthesiologist will proceed with the induction of anesthesia. Your surgeon will perform your surgery. Surgery will last approximately 1 to 4 hours unless the surgeon discussed with you otherwise. Once surgery is completed, you will be taken to the post-anesthesia care unit, or the PACU. All spine surgery is done under general anesthesia. What to expect in the post-operative care area. You will be receiving IV fluids. You will be receiving oxygen. You will have a pulse oximeter on your finger. You will have a compressive dressing at your surgical site. You may have an ice pack at your surgical incision. You may have a drain to keep excess fluid away from your spine if it was needed. You may have a Foley catheter in place to help empty your bladder. You will have a neck or back brace on if this was ordered by your surgeon. PACU continued. Staff will work with you to make you as comfortable as possible. Staff will work with you to lower your chances of having an upset stomach. You will have a compressive dressing at your surgical site. You may have compression stockings or TED stockings. You will have lots of blankets to keep you warm. You will be encouraged to deep breathe and cough frequently to prevent fluid accumulation in your lungs. Once you are awake and comfortable, you will be transported to your hospital room upstairs. If your surgery is being done as outpatient, you will be discharged home from the PACU area. What to expect as the support person. After arrival at the hospital, the patient will be taken to the preoperative area to be prepped for surgery. Once prepared, a staff member will bring you back to the pre-op area to see and wait with the patient. Once the patient is taken back for surgery, you will return to the hospital waiting room in the hospital lobby. When the surgery is complete and the patient is ready for transfer to their room, you may wait in the room for them on the 3rd floor. At OSS Hospital, all rooms are private and include a bathroom. There is no limit to visiting hours. A support person over 18 may stay the night with you. We have, at your request, room service dining from 7 a.m. until 8:15 p.m. daily. Your support person can buy a meal voucher for $5. Flat screen television and free Wi-Fi are provided, and a phone with ability to make outside phone calls. After surgery and once you are transferred to the 3rd floor, a registered nurse and a patient care tech will be caring for you. Your blood pressure, temperature, and other vital signs will continue to be monitored. Medication and ice packs will be administered by the nurses. You will receive education on all medications. You will be instructed on breathing exercises, leg exercises, and pain management. Your diet will start with clear fluids and then progress as tolerated to regular food when tolerated. Chewing gum after surgery may reduce your chances of developing stomach or intestinal issues. We will provide sugar-free gum 3 to 4 times a day and encourage you to chew it for at least 10 minutes. Do not get up without staff assistance, and a hospital stay is typically 1 to 2 overnights. Patient Safety Contract. The nursing staff at OSS Hospital encourages you to partner with us for your safety. I will follow the guidelines below to ensure my safety while a patient at OSS Hospital. I will ask for assistance before I get out of bed, the chair, or the toilet by pressing the call button and waiting for help. I will always put on non-skid slippers or shoes before standing. I will rise slowly when getting out of bed, chair, or toilet to prevent dizziness. I will use assistive equipment as instructed. I will give myself plenty of time to go to the bathroom so I do not have to rush. I will wait for a staff member to assist me to get out of bed, the chair, or the toilet, and will not ask family members to assist me instead. I will give the nursing staff any medications that I have brought from home, or will have my family or support person take the medications back home. I will not take any medications that I have brought with me unless ordered by the in-house medical staff. Family and support person information. If a family member is worried about a patient's condition, they will share their concerns with the patient's nurse. If still concerned, ask to speak with the charge nurse. If still concerned, ask that charge nurse to notify the medical response team. If a family member or support person is with the patient and is leaving, he or she will inform the patient's nurse. Managing pain after surgery. You will have pain after surgery. Do not expect your pain to be a 0. This is how the staff work with you to manage your pain. 0 means no pain. 10 is the worst pain imaginable, about to pass out or totally out of control. 6 to 7 needs work, and 4 to 5 are acceptable pain levels for most people. You may be ordered pain meds to be taken at regular times, as well as others to be taken as needed. If you are ordered an as-needed pain medication, you and your nurse will work together to create a schedule of when you can take the pain medications. How much medication is used is based off your vital signs and how sleepy you are. Staff will frequently ask you about your pain level using the scale below. This is a simple descriptive pain intensity scale. 0 is no pain. A 2 is a mild pain, moderate but tolerable. No pain medication is necessary. A 4 is moderate, uncomfortable, but tolerable. Pain medication is helpful. 6 is a severe, can participate in activities and or physical therapies. 8 is very severe, cannot participate in activities, physical therapy, may cause nausea and or vomiting. 10 is the worst possible pain. This is an emergency or you feel as though you're ready to pass out. Managing pain after surgery. While we do use pain medications to manage pain, there are several other ways to lower your pain as well, with the use of ice, heat, gentle massage, exercise, and rest. Activities that require your focused attention, such as puzzles and games, can also be used to distract your mind from focusing on any pain that you may be feeling. Occupational and physical therapy. You will see occupational or physical therapy the day of surgery or the morning after. You will have 1 to 2 therapy sessions per day, depending on your length of stay. Education will be given on surgery-related precautions. Your therapy evaluation will include device assessment and recommendations, ADL training and ADL mobility training with assistive devices as indicated or recommended, transfer training for toilet and bathing, home safety education, caregiver education and training, instruction on how to get in and out of bed, assistive mobility device assessment and recommendations, ambulation and gait training, home recommendations, can include transfer instruction, and home exercise education. A case manager is part of your medical team. The case manager will help plan and coordinate your discharge. They work with you, your surgeon, PT and OT, nursing staff, and support person to determine the safest and most optimal discharge plan. The case manager will meet with you to discuss your discharge plan. If it is determined that you will be going to a rehab facility, case management will coordinate this. They will order additional medical equipment as needed. Case management will set up any home health that may be needed with OSS Home Health or an outside facility. Preventing complications. Constipation, daily stool softeners, laxatives as needed, increased fluid intake. For nausea, your diet will be advanced as tolerated. Anti-nausea medications will be provided if needed as well. For swelling, you can apply cold therapy, and if you are having cervical spine surgery, eating soft foods is recommended. Urinary incontinence. This can happen immediately or within a few hours after your surgery. This is normal. Staff will do all they can to keep you clean, protect your privacy, and keep you well informed during this stage. You may have a urinary catheter to drain your bladder. This could possibly cause a urinary tract infection. Symptoms of an UTI include cloudy urine, blood in your urine, strong odor to urine, urine leaking around the catheter, pain or discomfort in your lower back, pressure in abdomen or bladder, and a chills or fever. If this happens, hospital staff will provide you with further education. In an effort to prevent pneumonia, an incentive spirometer, deep breathing, coughing, and early mobilization is encouraged. In an effort to prevent infection, you want to keep your surgical site clean and covered with a bandage, IV antibiotics for 24 hours post-operatively, hand washing you, your family, and any caregivers. Don't be afraid to ask people to wash their hands. Preventing blood clots and DVTs. To prevent blood clots, early mobilization, TED stockings, sequential compression devices, blood thinners are not usually used with spine surgery due to the increased risk of bleeding. Signs of a blood clot include increased extremity swelling, warmth, redness, increased pain, and tenderness to the area. These are typically found in the posterior aspect or the back of your calf. Any concerns for a blood clot should be reported to your surgeon's team. Discharge planning and what to expect. You will meet with a case manager to discuss the discharge plan that best meets your needs. You must be cleared by your surgeon, the medical doctor, and physical therapy prior to being discharged. Once cleared, the nursing staff will go over your discharge instructions with you and your support person. Instruction will include medication information, appointments, and your care. Your therapist will give you home exercises to do on your own at home, instruction on breathing exercises, instruction on post-operative precautions. Discharge options include home with family assistance, home with home health. Home health is considered for those who are unable to leave their home except for appointments. Home health includes skilled nursing, physical therapy, occupational therapy, social work, and home health aides. Rehab facility or skilled nursing facility. This provides skilled nursing care and rehab for patients experiencing the need for additional medical and physical therapy and occupational therapy. For patients that need to become more independent with activities of daily living prior to returning home. The case manager will arrange this with your insurance and the accepting facility. General post-operative instructions. Activities to avoid or limit until your first post-op appointment. No driving. Lumbar surgeries for approximately 2 to 3 weeks, and from cervical surgeries approximately 2 to 6 weeks. No bending, lifting, twisting, pushing, or pulling. If it cannot easily be lifted with one hand, do not lift it. No vacuuming, no sleeping on stomach, no sexual intercourse, no exercise or strenuous activity, no smoking, and for cervical spine, no turning head or tilting it forwards or backwards. You do not want to lift your chin. Activities that are encouraged post-operatively. You may sit, stand, and walk as tolerated. Take short, frequent walks each day. Gradually increase the distances tolerated. You may go up and down stairs slowly. You may ride in a car. Just avoid long car rides unless you're able to take frequent breaks and get up and move. Wear your collar or brace as instructed by your surgeon. This will vary depending on what brace that you have, on how long you may need to wear it. The brace difference per surgeon and based off the type of procedure. Please follow instructions given by your surgeon. General post-operative instructions. For wound care, you would want to sponge wash until your first post-op. Call your surgeon if redness or increased swelling is noted under or around the dressing. Remove dressing 5 days after discharge from the hospital. Steri strips will stay in place. If there is no drainage once dressing is removed, may leave incision open to air. If having drainage once dressing is removed, recover incision for a few days. No soaking incision, no pools, hot tubs, or jacuzzis. Pain control at home. You'll be given a script for pain medication at discharge. Take this as directed. You may be given Tylenol between doses of stronger pain medications. Pain medications may cause constipation. Increase intake of fiber such as prunes, fluids, fresh fruits and vegetables. Also use a stool softener and or a laxative if warranted. Pain medication may cause nausea. Please take with food to avoid this. Alternate rest with activity several times throughout the day. Be sure to get enough sleep during your recovery. Use of ice at your incision helps with swelling. Try non-medication pain relief methods such as positioning, meditation, deep breathing exercises. Once you are feeling more comfortable, begin to decrease the taking pain medication by lengthening the time between the medication. Lower the number of pills you take. Switch from narcotic pain medication to over-the-counter pain relievers as tolerated. Do not take NSAIDs such as Advil, ibuprofen, Motrin, Aleve, meloxicam, or Celebrex until instructed by your surgeon. When to call your surgeon. Call the office if you have any questions, concerns, or problems. There is always a physician on call. Any prolonged drainage from incision, severe muscle spasms or pain, any signs of infection such as redness, swelling at incision, or pus, any nausea, vomiting, or headache that gets worse when upright, any symptoms that are unusual or cause concern, for cervical spine, difficulty swallowing, or extreme hoarseness. Your first follow-up appointment will be scheduled to see your surgeon and or his physician assistant approximately 2 to 3 weeks after surgery. At this first post-op appointment, you can expect an x-ray may be taken, your incision will be checked, staples and or sutures may be removed, you'll be evaluated for any complications, and your progress with walking, strength, and function will be evaluated. Things to remember. Review the information in the binder you were given. You will find the answers to many of your questions inside. Don't be afraid to ask questions. We are here to help you through your surgery and recovery. If you have questions about any of this information, you may call our Patient Experience Office at 717-718-2031 or your surgeon's office at 717-848-4800.